So with this, I would like to introduce the next speaker from Canada, Attila Farkas, who also took the effort to fly all the way over here to RIM. And Attila will
Let me tell you, it wasn't hard.
Oh, that's good to hear. Attila is Senior Director at Canada Health Infoway, and he will share about all the exciting developments in Canada.
Thank you so much for that. It's a pleasure to be here. As I was introduced, Attila Farkas, I'm a Senior Director with Canada Health Infoway. I had the privilege to going to the IHE Experience Days last year in Montreux as well. And it was a fantastic opportunity to talk to European countries and others around the world that had the possibility of attending. So I decided to come and continue the dialogue. The title of the presentation, as you can see, is Interoperability from the Lens of the Pan-Canadian Interoperability Roadmap. So in Canada, we have been on this digital health journey for quite a while now. In fact, Infoway was established 20 years ago. And we are a not-for-profit corporation established to support the federal government with investments in healthcare delivery. And the first 10, 15 years of our existence was focused on literally making investments into a variety of registries to collect health data. We thought that that will be the solution to actually enabling interoperability, but it turned out not to be so. So now we're at the second stage in our journey, and we are focusing significantly on these two factors here. You see digital health interoperability as a main pillar, and we also have a prescribing service that has been developed for the last 6-7 years in Canada. It's called Prescribe It, and it is gaining better and better adoption for medication management and dispenses. So what you need to know about Canada is that it's a federated country. We have 13 provinces and territories, plus the federal government that also administers health to the military and a couple of other areas. It is universal health insurance, so it's public health funded by the government, but it's the jurisdictional healthcare agencies that are responsible for care delivery, not the federal government. In fact, the federal government doesn't have any authority in jurisdictions to prescribe how certain things are done. This is where we come in. We are a basically arm's length organization that has been working very successfully with jurisdictions, with the market at large, and we're hoping that by continuing this, we're going to potentially reach that state, that nirvana, where things just start working. So over the past year, I would say, Infoway has been leading an effort to work with the market and with jurisdictional leadership to create a Pan-Canadian interoperability roadmap. We feel that one of the biggest obstacles to interoperability is not knowing where you're headed. So if you are just always looking down to solving a problem, but you lose the context of the bigger picture, then chances are you're going to get lost. So we figured it's probably best if we put together a roadmap that speaks to the intent, to the direction, to the philosophy of what we want to do, and then socialize that, get buy-in from jurisdictions, from the market, and then start marching towards that new goal. This gave us a very big opportunity in Canada. There were a couple of think tanks and a couple of, again, not-for-profit academia and forward thinkers that over the past 2 years have been placing a lot of focus on trying to change the way we think about healthcare to make it a little bit more patient-focused. In Canada, as probably in other parts of the world, care delivery is very clinician-focused. Everything is about the clinician. The patient has to come there. They have to follow up with everything. They're not really the center of care. And we're trying to change this. We're going to try to, as you can probably try from these concentric rings, we would like to start establishing data exchange and services that are patient-focused. And then by doing that, we're going to enable the market to better provide care. I will not read the entire slide, but it is recognized that you cannot possibly be successful with interoperability if you only focus on the technical part itself. it is extremely important to engage a number of other areas of the care delivery. And some of them have been listed here, and some of the principles that we truly believe in are listed in this picture. So once the roadmap was endorsed by jurisdictional leaderships, and it was published in May of this year, the realization came that because interoperability is going to be such a complicated problem, and that usually requires years of development of infrastructure and then moving the market, it would be best if we were to approach the problem with very concrete outcomes that we would like to reach, meaning we identified 4 areas that absolutely needed improvement and quickly. So we challenged ourselves that over the next 2-3 years, we're going to lead transformation in the marketplace that will have marked improvements in the area of reducing data blocking between vendors so that data can start finally be liberated and belong to the patient indeed, to improve the provider's access at the point of care so that they actually have access to the patient's entire longitudinal record. Then the patient itself should have access to their longitudinal patient record, and finally, care collaboration, e-referrals, e-consults, as we call them in Canada. And so what you see at the bottom of the picture is the realization that while these are sort of top-down, and maybe the next slide is a better, actually no, let me go back for a second. While these 4 areas are top-down sort of initiatives that immediately will show you results, we recognize that they're going to have a need for supporting systems. So we call them bottom-up building blocks, meaning if you want to do a digital identity for a patient, or you want to do proper security, privacy by design, if you want to do robust interchanges of information, you will need certain core capabilities in the ecosystem for these to work. But those are the building blocks that people never see. It's like plumbing in a house, right? It's not very attractive. Nobody really cares about investments in that. They want to see results on the top. So the roadmap was organized in such a way that it goes top down and bottom up. I talked a little bit about the details of the 4 program areas. I put this slide into the deck because I know the deck's going to be distributed, so I'm not going to spend extra time on it. You will get it and you will be able to read it for yourselves. But the way the roadmap is organized is basically collected in summary in this picture. It's a little bit of an eyesore, I know. It's really hard to, an eye chart, it's really hard to read, but what you see here is the recognition that you cannot have interoperability without having good quality data. So we have the data framework. You have to have a very good way of predictably exchanging and accessing data, so the exchange framework, and then finally the trust. Absolutely, just like Didi mentioned, TEFCA is recognizing that, and it's raising the entire market to a whole new level the moment you have legal backing and predictable rules of the road. So we felt that you cannot possibly solve interoperability without equally lifting all 3 areas: data, access, and trust. So doing that, we then also recognize that fine, so we're going to do specifications, we're going to invest in technology, we're going to have good data. But none of this will work if you do not have proper enablement in the ecosystem. In other words, we want to mobilize not just the market, but also those that purchase solutions. So the jurisdictional integration teams to have procurement processes that recognize the value of properly developed specifications, products that live up to this, conformance-tested applications. So you see here a couple of the services that we have listed as absolute must-haves in order for the program to proceed. And I have here a slide that we put together on a sort of a back of the napkin in one of the biggest brainstorming sessions with my team. And then we turned them into the so-called escalator slide. And what is it that this slide is trying to convey? Usually standards and implementation guides are developed at level 1. This is where the geeks, some of you being probably very well listed in that category, recognize this is where we collectively come together and figure out how to do the best specification possible. How do you do interoperability? But nobody really cares about this. Everybody cares about level 3. This is where clinicians and patients are consuming services. So you have to know that you cannot go from the interoperability products, which are developed at level 1, to clinicians using it overnight and without pain. So what we're showing here is that you first need to do an adoption activity between level 1 and level 2, and level 2 is the user of technology, jurisdictions, those that are buying technology, vendors, and you have different tools that you need to employ to do the adoption between level 1 and level 2, as opposed to the types of tools you need to engage between level 2 and level 3. That's where you would apply change management. That's where you would imply incentive schemes for the market to buy into this thing. So recognizing that this is not a linear path, it's literally a spiral of evolution, we can work on both top-down and bottom-up problems by unifying the market around these concepts. So then, one of the last slides, I wanted to highlight that the way we even think about the interoperability specifications are products. And this is very important because you expect vendors who sell products and do a proper quality control and everything to implement stuff that we're sort of developing with subject matter experts in standards, right? So you have to recognize that if you put out standards and implementation guides and specifications, those also need to be at the level of quality that vendors expect or we expect of vendor products. And what I'm showing here is that the way we're approaching it is so that we're trying to enforce this plug-and-play architecture where once you define your products, you also finish the job by creating a reference implementation and a conformance assessment tool for it, so that every single thing that comes out of this shop will be able to self-test. And if a vendor basically says, yes, I can do it, by the way, we're also using Gazelle, they could literally just come and test against the reference implementation, and then you go to projectathons and finally connectathons to include. So this slide talks a little bit about the fact that you cannot just do it with standards development. You have to have the conveners, the subject matter experts, and all of these levels of participation are absolutely important in order for us to succeed. This is one of the reasons I'm here, because you learn more at a conference like this than you could in months reading the web at home. And with that, I will stop and take some questions if you have. Thank you.
Thank you so much, Attila. I'm sure there are questions for you. Let's have a look around. Charles?
Attila, is there a use case which is the one where you are the most advanced in having gone through the 3 layers and all of this, or on the most advanced one, which one it is, and where do you think you are today?
Thank you for that question. So over the past 2 years, we have taken on the adoption curve of IPS in Canada, and we have done 2 successful projectathons in Canada around the IPS. We don't call it IPS because we want it to be very clear that there's a gap between what the country can do today versus where the IPS specification is. But it's a perfect opportunity to test ride an international specification and actually take back to standard development organizations the feedback that you're finding. Where is it that it's squeaking? Where is it that you cannot possibly go just yet? How do you integrate it with exchange patterns? So we have a trial implementation version of IPS that's in the market. We had 9 vendors come to test in March of this year, and quite a few managed to create well-formed international patient summary FHIR documents. And we developed a so-called Canadian FHIR exchange specification that is similar to the QED, but it's looking a little bit forward to be aligned with the international patient access specification that's going to become, hopefully, fingers crossed, the FHIR exchange standard between health information exchanges in Canada. So that's the most advanced that I would say that went through all that. And currently, we have the 3 biggest provinces in Canada that are collaborating with us on adoption. So
you're at level 2, clearly, solid. Not quite at level 3 yet.
Not level 3
Okay.
yet. Yes.
Thank you.
And we have two projects that are now very much kicking off and becoming probably the poster children of this new thing. The e-referral e-consult, so basically requests for either consultation for patients or between physicians, and the primary care data portability is another one, where we would like to see that data for primary care can be ported from one EMR system to another and become part of the patient's whole longitudinal record. Yeah.
Thank you. Any other question for Attila?
Thank you.
No? Oh, yeah, one.
Do we have time? Yeah.
Yes, we have a little bit of time.
I like the sheet with 3 levels very much. Compliments. But in my opinion, the people who are working on that levels are very different, also in mindset. So do you agree? And how do you create bridges between those mindsets?
Wow, that's an awesome question. Thank you very much for it. That's exactly why we wanted to create that picture. Because you're right, it's a very different conversation when I have it with jurisdictional policymakers who are usually held to mandates of the political party that is in power at that time, or clinicians that are basically just overwhelmed with the amount of patients they need to see and the relatively poor quality of the electronic health systems that they currently use, right? And that's why we wanted to put together that picture, because we noticed that in some cases you need a little bit of incentives for one category, where you need a bit more training and a little bit of buy-in from another category. So with clinicians, we're finding that change management is significantly more conducive to success than it is with jurisdictions. With jurisdictions, you have an opportunity to say, I will make your life easier if you agree that you're also a vendor. And we had this conversation during coffee just now, that jurisdictions think of themselves that they are responsible for hosting patient data, but they can do whatever they want because they're responsible for hosting patient data, and they just buy vendor solutions. So we're trying to promote this culture of conformance-tested integration, where they should recognize that they're also vendors, because they usually set up these EHR systems. They have investments, sometimes even technical teams that are bigger than some vendors, and they develop software and they develop and support, run their services, right? So it is challenging, I'm not gonna lie, because every category requires a different message. That's why we have principles, and we're trying to point them back to them and say, okay, we agreed we do this collectively. But unfortunately in Canada, or fortunately, I don't know how you look at it, we have no stakes. Everything is just carrots, if you even have carrots. Sometimes it's literally just personal connections and trying to do the right thing.
Thank you. Then there's one more last question from Derek, I believe. And then
I hope that this doesn't turn into a long answer, Attila, but you did introduce that Prescribe It was one of the other pillars of the strategy.
Right.
And one of the things that's interesting about Prescribe It is, for the first time, Infoway went from an infrastructure creator to being an infrastructure operator. And I just, maybe if you could briefly say, what were some of the lessons learned from that process for Infoway? And what are some of the ways that that plays into and is synergistic with the rest of the roadmap?
Right.
And sorry to ask that long one at
Absolutely.
the end.
So in full disclosure, Derek is also a Canadian, so he's obviously aware of Prescribe It. And I will try to take it up a notch, just to be a bit more generic and answer it quickly. Like we saw the Netherlands present with a very strong focus on medication and medication management, right? So that's the holy grail. When you have the best possible medication history, it's what everybody's looking for. And Infoway was sort of, quote unquote, preaching about this for years before, but nobody was really taking up a consolidated approach to electronic prescriptions and medication management. So 6-7 years ago, InfoWay decided, okay, we're going to step into the ring and we're going to try to set up a service, a national service, that's going to come with its own specification, and it will conformance test the vendors, and we're going to run the central hub of the service. And it was fraught with a lot of pain, because it's really hard to step in as a not-for-profit and tell the market what to do. They usually push back on that. And Didi also mentioned something about this. Sometimes it's not welcome for the government to necessarily come in and say what you do. That's probably why it worked, because InfoMe is not really government. It's a not-for-profit. We were aiming to do investments in this, but eventually that it should be cost neutral. So that's probably the biggest lessons learned, that you cannot succeed unless you have government, policymakers, and market participation at the same time. And then it kind of works, but we're still not there yet.